Okay, let's talk about niche markets, or however you want to pronounce this. I always mess this up actually. What areas can you hit in this industry that a lot of agencies are not looking into? The first one is the pediatric care. If you try to look for pediatric home health agencies in your area, there is not a lot of those type of agencies. We try to tend to work with a lot of seniors, and that is it. So one of the biggest niche markets to be able to enter into is the pediatric home health services. It's very good for both medical as well as non-medical and private duty. The next one is non-medical. So for a lot of you guys out there who are home health agencies, who are medical home health agencies, typically they do not like to have non-medical when this is a great source of income. You have to understand you already have the resources, you might as well start using it and providing it rather than giving it to somebody else. So for you non-medical people, be happy. Be happy the fact that you have home health agencies that could be potential referral sources. So you want to be able to attack and use non-medical. Some of the top franchise organizations nowadays are in the senior home care field. There are franchise organizations right now that are bringing in hundreds of people to join their organization to start a company to provide non-medical private duty. And you have all these approved home health agencies who don't even want to offer these services. There's so much money to be made in the private sector, in the non-Medicare billing, non-insurance billing world. Third one is your Advantage plans and insurances. Are you accepting Advantage plans? Are you accepting managed care plans? A lot of medical home health agencies are just relying on Medicare, are just relying on basic insurances to accept. So you need to start looking into other payer sources. Are you accepting Medicaid? Yes, the income, the profit is lesser in Medicaid, but if you work hard enough and bring in a lot of clients, there's a potential income for you to be able to be made that makes you stand out. Are you grouping with other home health agencies? You have a bunch of ACOs that are building out right now. Have you tried to link up with other home health agencies and created your own PACs, your own post-acute care organizations, where you can set up a group, a team that can market yourselves together and be unified to market to hospitals and nursing homes, to be able to have that one idea outlook and show other companies that you're willing to join together to provide great care. So what are the other niche markets you think you can actually enter? What other subjects and offers can you actually provide with your company that makes you stand out? How do you literally differentiate yourself? Can you differentiate yourself? Now, I also put here culture-based marketing. Very important. How do you differentiate yourself? Well, cultural-based marketing. Do you have Spanish-speaking nurses? But the worst thing about this is, do you have brochures and marketing materials that are just meant for Spanish speakers? What is the number one and number two second spoken language other than English in your area? If you're in Chicago, then you have Polish. If you're in California, you have Spanish. So what in your area is the first and the second one? And even the third and fourth, and use that to market it. Bring in the people that can actually work with those type of clients, those type of patients.